Test. 1, 2, 3. Test. Check. Mic. You want to talk? Check the mic. 1, 2, 3. What would you like to say, Bean? You want to say, hello, listeners.
That's all. Hello, listeners.
Yeah, welcome.
Welcome.
Yeah, very nice. All right, this is Carrie from Wrap Your Head Around Silks. This is the Expecting Aerialist podcast. How's it going, guys? Thanks for being here today. I've got the Bean. Say hi.
Hi.
Hi, listeners. So if you check the show notes, I have a new project on the way, in the works, called Aerial Rehab. It'll be a free 3-part video series that you'll get in your inboxes. So check the show notes for that. I'm really excited for you guys to see that. Today we have Dr. Janae. Okay, she's back. So she was the person I wanted to start season 2 with the breakdown of a cesarean section, and she is back. I've asked her to talk about postpartum and everything that at least I wasn't told before I gave birth. So we get into it. She is a firecracker. I'm obsessed with Dr. Janae, and I hope you will be too. All right, guys, let's get started. Bean, can you say let's?
Let's
get started.
Started.
All right, guys. No, this is amazing. I'm going to start recording because you're going to say something epic and I'm going to miss it and we're so mad. So it's just recording, but no stress.
Well, I don't know how epic. So we're moving. I don't know if I told you that. So this has just been hot mess shenanigans. And I literally don't know how to do anything. Like even just freaking signing up for Turn On Spectrum or Netflix or whatever. Roku. I bought this whole TV, had to rebox them because it's not compatible. I'm like, I don't even know what a Roku is. Like, I gotta get with the times.
Well, yeah. Because you're too busy.
I'm too busy. Well, I'm working on adulting though, so I'm gonna stop being so busy and start being accountable to my time.
Okay.
So I'm stop putting so many things on my list of things to be doing,
including be on a podcast all the time.
No, I actually like this. And FYI, my kid, because it's hair day, because you know how that is for black folk. This hair day, so I'm braiding hair today. And so I was like, you can put your headphones on because mommy's going to do some adulting. And you're not going to be able to hear me.
So is she sitting right there and you're doing her hair?
Yeah, I got to cornrow all of it.
Okay. So, Janae, I'm eating bread. I should stop eating. So.
Nope. It's fine.
Well, it's not fine because I host a podcast. I'm trying to be profesh.
I don't even know why you would do that. It makes people feel very endeared to you.
Okay, well, so people are obsessed with you and the way you're talking about cutting them open.
What?
Because, okay, here's a great example. I have a friend who had a baby at the kind of the same time as me. She had a C-section. She listened to it. Okay. She gave it to her mom to listen to because she was like, you need to listen to this lady explain this because no one's ever explained this to anybody, ever.
Oh, absolutely. That's what happened. I bet it happened just like that, didn't it?
I mean, yeah. So it was like really informative for a lot of people.
Good. I'm so glad. I don't know how to follow that or watch that, so I have no idea what anybody thinks. And I'm like, oh, I hope they don't think I'm a complete whack nut.
No, there's no way for you to follow it because I can follow my numbers, but it's not out there in the public. So
not even follow like the
reviews and stuff.
Oh, she's crazy.
Oh,
well, just even if they just told you she's kind of crazy, right?
No, because crazy comes across really well in a podcast. It's just entertaining. Right. Yeah, good. They were so.
Good. I want to be. I can't wait to talk about whatever.
Okay, so here's the deal. I want us to do the same type of breakdown because. Okay. Even for me, I have a lot of friends who had babies at the same time. The amount of stuff that we called each other or video conferenced each other and was like, did anybody tell you about X, Y, and Z before you got pregnant?
Yeah.
No. Postpartum. What happens? Yeah. So I want to from your perspective, you are clinical, you're a doctor, you see your patients. So let's go first to your girl parts. Talk to me about vaginal. You have a baby naturally, meaning a vaginal delivery, whether or not you had meds or not. Tell me about the first week, the fourth week, like 6 weeks. Yeah.
Gotcha. Well, here's the thing. The thing about having a vaginal delivery, a couple things really matter. One, was it your first baby or not? Let's start with this was my first baby, and something came through my vagina around the size of a large grapefruit through an unaccosted pelvic floor and vagina. Now that shenanigans, right? So the recovery from that is completely different than when you've had a baby before. So just talking about the first time, it really depends on how a person, literally depends on what their hips feel like. So when we do a check on people when they first get pregnant, like we do a pap smear and we do their little exam and stuff, sometimes we'll say, hey, this is kind of a tight pelvis, like note to self. And we write tight pelvis like in our notes to remind us about that. What that basically is talking about is what is the angle of the pubic bone. There's cartilage that holds together the front part of your pubic bone, because here we go. Get ready for it. That's right. Your body has to split your pubic bone in half to get a baby to come out. Nice. Good one, God.
Wait. The pubic bone splits during labor or over time in the process?
Well, over time. So here's the thing. So if your arch is narrow, then it is an acute angle, like a piece of cheese or something. I don't know how I can say that, wedge, if you think about that wedge. Or it's a flat angle in which it's really wide, right? Like if you took your finger, index finger and thumb and widened it out as much as you could, that's a wide angle. If you scrunched them together, that's an acute angle. So when we check a person, we are checking the angle right there to say, how much give has to happen for this baby's head to fit out.
Okay, wait. You check by feeling it with your hand on their skin, or you do an x-ray?
Nope. Inside, when we do the exam to say, oh, you're 4 centimeters, or your zippos, you ain't jack crap. Like we're saying, like, where is that baby's head in relation to your pubic bone? And what is that pubic bone doing? So, for example, if I put my hands in there to check somebody at 36 weeks and I feel nothing but the abyss, sister, I'm like, mother of God. That head is not even remotely close to the pelvis. I can't feel it. I can fit 2 fingers inside that arch. That means, yikes, you're either really far from ready to be delivering, the baby is floating, the baby's head is what we call asynclitic, which is crooked, any of those things. But when you're 36 weeks, you're not supposed to be all the way fully engaged, which we mean like really settled down in the pelvis. It's just for us to have a gauge like, hey, sis, by the way, your belly's measuring 2 weeks ahead and your pubic bone is narrow. You might have to push a long time. And I tell people there is not a person, I'm thinking not very often at all, that we tell a person, hey, you really shouldn't try a vaginal delivery. I tell people, hey, listen, sis, looks like you got a narrow arch. Get ready for pushing. Like, this ain't about to fall out. You know what I'm saying? Mine were 5 pounds. They fell out. There's, like, nothing to brag about. But I tell people, like, hey, listen, you're going to have to get ready to push. And the reason why you have to get ready is because that pubic bone is held together by cartilage. And your body, because it's amazing, that's right, hashtag winning as women, our bodies are so amazing, that our placenta gives off a hormone called elastin. Elastin is something that softens up cartilage in your body. So that cartilage, that hunk of, pretend you got 2 chiclet pieces of gum holding your pubic bone together, that are really, really firm like cement. Well, your body knows a baby has to come through there. So elastin that comes out of your placenta softens that cartilage up so that when you need to push a baby out, it'll give and open up that arch. That hurts like a mofo, like a mofo. That's why when people are around 36 weeks, 35 weeks, they're like, man, I'm walking and it feels like there's a bruise like right in my pubic bone. It's really hurting. Like, I don't know, and then when we go to measure your belly and we take that tape and we shove our thumb right down there on that pubic bone to try. I don't want to turn it. Dr. Davis. I'm like, I know, girl. It's the last, and I'm really sorry. That means that's loosening up for you. Now, the benefit is, okay, I'm loosening up my pubic bone. The non-benefit is, guess what happens to the rest of the cartilage in your body? I.e., all you swingy dancers around here, you're going to slip your knees easier. You're going to slip your ankles easier. You're going to slip your hips easier. You're going to slip, and your nose and ears actually soften, but nobody probably cares about that. So nobody talks about it. But that pubic bone, our body's giving us the ability to literally disrupt that, stretch that out. That pubic symphysis allows a baby to pass through there. That being done one time hurts like a mofo. The second, third, fourth, fifth, sixth time you have a baby, that's been done already. So a lot of the consequence for your recovery, which is why I talk about first versus any other baby, the first time you pave the way with a baby, praise the Lord, it's not nearly as bad the second time. That was a long answer.
I'm over here, like clutching my pearls over here.
Yeah, girl.
No, okay, so wait. So it goes apart, and I've heard about pubis since, where it just, there's a lot of pain after because it's not even.
Yeah.
But for a woman who doesn't have that.
Who has a C-section?
No, who has the vaginal delivery, but not what they call is it pubis, whatever that is that?
So your pubic symphysis still is going to split unless you had like a super small baby. But the other thing that people don't realize when they're like, yeah, I'm totally going to get back to doing plyometrics 5 minutes after I had a baby because it doesn't hurt. I'm not caring whether this hurts you to do it. I'm telling you that your body has not evacuated enough elastin and you're going to slip your pubic bone. So I had somebody who sat down too quick and slammed herself down into her car because she was jumping into a Jeep because she thought, day 3, I'm taking my newborn out to the beach, whatever it is, slipped her pubic bone, and she had to go to orthopedics and get a pin put in it because the spacing in it was so far it couldn't heal back together. So it's not a matter of it's hurting your body like I'm sore or not. It's a matter of letting your body heal into some solid pelvic structure so that when you sit down, get up, have sex, jog, run, lift weights, deadlifts, lunges, presses, that your pubic bone doesn't slip. I think that's a misconception for a lot of athletic people who think, oh, I'm totally fine. Well, happy for you, but don't be coming in here complaining to me whenever your pubic bone is on fire and you can't get your crap back together. That is a you problem, and we told you don't do that.
Okay. Now I'm starting to understand.
You're welcome. Mm-hmm.
Okay.
That's my favorite. I have weightlifters. They're like, I totally have a high pain tolerance. It's not about that. It's about whether that gets put back together. Now, your next babies, like I said, that has already been accosted. So the babies just fly out. Like when we say, oh, you pushed 4 hours last time? Yeah, it's probably going to be 30 minutes, if that. Like that's what we mean by that, and that's true. So the recovery afterwards, the first time it feels like, holy mother of God, like what came through my pelvis? You go to pee and it feels like you have shooting lightning up your vagina. Like I remember crying like, ah! Like when I went to pee, I was minding my own business, girl. Minding my own business, just peeing. And I don't know what happened. My bladder spasmed or something. I thought somebody stuck a hot poker up my vagina. And then it went away. It was totally fine. You have to settle all that back down to normal. Like a child just came through there. So yes, you're going to be sore. Absolutely. You are going to be sore. And random things will happen. I said, I don't know. I overdid it. I went to Target. Well, stop going to Target, overdoing it. We told you to sit down and relax.
Okay, so
because you just thought you had to go to Target.
I'm gonna throw some misconceptions at you or things that my friends and I have said to each other. So okay. So one of my friends said, "Why did I have basically pains that she characterized as almost worse than labor, like days, a week later on?"
You mean like down in your uterus area or the... Yeah, it's because your uterus has to clamp back down. Like just like we talked about that C-section, you're talking about something that went from all the way pushing up on your diaphragm. Specifically if you're nursing or pumping, you are shooting out more oxytocin through your brain from the stimulation of your nipple that is going to make your uterus contract down even more.
Okay.
Like it's ridiculous. And everything in your whole belly is resettling itself. Just think what came out of there. Like your bowels have to go back to their normal position. Your round ligaments have to go back to their normal position. Like your freaking gallbladder isn't getting shoved on by a baby's foot anymore. Like all of your whole entire abdomen is going back to normal position. And when we move things in our body in the visceral cavity, that can shoot pain. It's not supposed to be moving like that.
Okay, so when it feels like she's just felt like she was giving labor again. Is it because the uterus is contracting and that contraction feels kind of the same as labor?
Literally like labor. That's why people who nurse tend to stop bleeding is quicker than people who bottle feed, because you're clamping your uterus down with the expulsion of oxytocin from your brain. So it's the same thing as Pitocin. It's oxytocin, but it comes out of your brain to make your uterus clamp down so that you quit bleeding. But the consequence of that is mother blanker. That's a lot of pain.
Why?
Secondarily,
why don't people tell us this? Like, no.
I do tell people that. I don't know what y'all boxes is doing.
They're not telling us shit, Dr. Janae. Okay.
Yeah, I'm like, oh, by the way, this is about to be bad. Yeah, I'll tell you what else. If you are nursing, just as I'll throw out, and I'm sure we'll talk about it later, your consequence of nursing is that your body is going to turn you into a postmenopausal person. The hormones of your system are opposite when you're nursing as when you're not pregnant. So when you're nursing, your prolactin, which is the hormone that comes out of your brain to tell your breast to make milk, is opposite of your estrogen. So if you have a high prolactin, so I can make this milk, it makes me have a low estrogen so that I don't shoot an egg off and get pregnant too quick, right? It's my mammal body's way of keeping me from getting pregnant so that I can feed a child. So if you lower somebody's estrogen, the only time in your life that you don't have estrogen making you ovulate is when you're postmenopausal. Guess what happens to your little postmenopausal wrinkled up old lady vagina when you're nursing? It turns into a freaking desert abyss. I'm like, mother. And I say, by the way, it's going to feel like the first time you had sex. Girl, I hope you have a bottle of lube. I like Uber lube, but that's just my personal favorite. I hope you have a bottle of it because it's going to feel like somebody whacked you in the vagina with a bat.
Oh.
Without anybody. Correct. And there's no elasticity. You will not lubricate yourself just like you won't when you're 80 years old. And you won't heal as quickly because you have no estrogen to give you the elasticity and bring blood flow to the area to make yourself not feel like that. It's also, by the way, when you pee, it's going to burn like mother blanks. You're welcome. What you can do is take a big blap of Vaseline and stick it over your urethra so that when you pee, it doesn't burn because you're just rubbing the top layer of cells off your freaking urethra because you have no estrogen. And if you're looking for the happy time at the end of the event, F that. It's not happening. So just grin and bear it. For as long as you can, but it ain't going to get no better while you're nursing. So people are like, what is going to happen to my life? I don't. Well, we don't want to be doing something that's uncomfortable, and it's another physiologic way that we don't get pregnant, like that our bodies don't let us get pregnant while we're nursing. You need the energy and nutrient of your body to be able to feed this child. Now, when you stop nursing as much, when does that happen? Whenever people decide. First of all, I'm totally fine if people decide to bottle, totally. But physiologically, if you decide that you're not going to, as you cut down the amount of nursing you're doing, your prolactin level is going to get less and less. So here we go with our little seesaw. What happens to your estrogen? If our prolactin is going down, my estrogen is coming up. So then I'm getting a little more saucy in the vagina and I'm getting a little more lubrication. I might act like he's cute enough for me to want to do something. And I might heal myself afterwards without feeling like somebody shoved a freaking raw sandpaper freaking broom handle up my vagina, after we had sex. So, and you start ovulating again. So this is where people, which is the humongous misconception, I'm breastfeeding, I will not get pregnant. F that. You are spontaneously ovulating randomly as you are increasing your estrogen as your prolactin is going down. So maybe you weren't ovulating while your baby was Q 2 to 3 hours, shoot me in the face, Q 2 to 3 hours because your prolactin was so high. But as soon as your kid starts eating food, sleeping through the night, whatever those things are, your estrogen gets randomly high enough for you to be able to shoot eggs off. Well, people don't know that they ovulated, and they're 16 weeks pregnant talking about, girl, I can't lose this weight. I don't know what's going on. Oh, there's a fetus in there. Oh, okay. Because you're pregnant again, diva. You're welcome.
Dr. Janae.
Yeah, girl. Yeah, girl, that's what happens. That is what happens, girl.
Okay. And you do tell your patients this.
Heck yeah, I tell, because that is like a false advertisement. If anybody thinks it's supposed to be like a fantastic time postpartum, Oh, and how about when the liver falls out of your uterus? When the placental eschar, which is the big scab, about 7 to 10 days after you have a baby, a big plop of liver falls out into the freaking toilet, and you think you're bleeding to death. Yeah, there you go.
Okay, I had no idea. I didn't know about that.
Yeah, that's why I tell them don't call. These are things don't call me in the middle of the night. It's just your placental eschar. Yeah.
Oh my God, I didn't know. Okay, can you go back and explain what that is? What you just said, that scab?
Yeah, it looks like a big plop of half a liver. So when we pull your placenta off your uterus, I always tell people, just think about if I just took a I don't know, a big piece of steak and ripped it off the side of your arm, like ripped off half your arm. Like there's a scab that forms there. And when that scab gets ready to fall off, because once you pull that off of your uterus, the inside of your uterus, think about what it's doing while there's a baby in it. Shooting 50% of your cardiac output in blood flow to my baby. Your body cares about it. As soon as you stop doing that and you get that immediate contraction of the uterus, you also get what we call, it's called an autotransfusion. It's almost like when you shut the uterus down, think about all the blood flow that used to be going through that to the baby. It automatically goes back to mama. You get a transfusion almost back to yourself. Now, before you freak out about bleeding, you're supposed to lose about 1 liter in delivery. Don't worry about it. People are like, I almost bled to death. No, you didn't. Your body made 50% more blood flow than normal. If you had not been pregnant and been 50 years old, yes, you might have bled to death. But hashtag winning, we are made to do this. So no freaking out, everybody. This is totally fine. But anyway, that spot that we ripped off that placenta has a scab that forms on it so that it quits gushing blood out your vagina, or you'd bleed out, right? So when that scab is no longer needed, 7 to 14 days or so, it plops out, but it comes out literally like a piece of liver. It's so gross. It plops in the toilet. Sometimes because it's passing through your cervix, it's cramped, like your uterus goes squeeze, and it'll squeeze down. You might feel nauseous. You might feel hot, lightheaded. You might vagal. That's totally normal. That's totally normal. It's just the placental eschar. And FYI, don't call me about that at 3 a.m. Let's just talk about it around 8:30.
Okay.
9 o'clock.
Okay. Here's the other thing. Okay. My OBGYN told me nothing. All right. I will tell you, I learned all of this after I had the baby. So I did not. Okay. I had a C-section, right? I did not know that I was going to bleed like I had my period for a long time.
Oh, yeah.
No one told me. No one told my friends. I bled for 8 weeks straight. Is that normal? You talk. What is that? Is your body getting rid of the blood? Obviously.
Yeah, I mean, it depends on the person. Some people, they're like, oh my gosh, 3 days after I had the baby, no more bleeding. Good for you, diva. But yeah, that's not most people. If you're nursing, most people, because of the way that uterus clamps down, will stop. We'll have some brown discharge, probably still at week 3, 4, but they're usually done by then. If somebody comes to me and they're still bleeding at 6 weeks, or they call me and be like, dude, I am having a period, I will then do an HCG level on them to make sure they don't have any retained placenta. It's hard for a person to have retained placenta during a C-section because we clean your uterus out so good. But every once in a while, somebody doesn't, or they have what we call succiurient lobe that is like a little extra piece of placenta that was not attached to the regular body of the placenta that might have gotten left. So I'll check an HCG because your placenta will still give off pregnancy hormone to make sure you're not bleeding because you have something in there. And I mean, there's standard deviations for everything, and that's just one of them. So it's not typical for someone to still be bleeding heavy at 8 weeks. But if you did, I probably would have checked a level on you or gotten an ultrasound to make sure your stripe was.
It was light in the last couple weeks.
Yeah. It's just irritating.
I just didn't know. And my dog, I went to the doctor at 6 weeks, and she, I don't know if she just wasn't saying anything about anything.
Did you have an appointment at 2 to 3 weeks?
No.
Okay, so ACOG, which is the governing body of obstetrics and gynecology. So that's why I always.
Oh wait, no. I did because I had staples taken out. I did.
No, that's a nurse visit for staples. That's 1 week. ACOG says that you should have a 2 to 3 week visit, kind of like we call it the 4th trimester. We used to leave people alone and just talk to them at 6 to 8 weeks. And then all of these questions that you're talking about, number one, didn't get addressed, which is inappropriate from us from a healthcare standpoint. Second, we lose the opportunity to get that level for you or assess your bleeding, and more importantly, to assess your mood postpartum. So a lot of people would show back up to their postpartum visit at 6 to 8 weeks And I'd say, hey, how's it going? Fine. How's your mood been? It's fine. Because after 6 or 8 weeks of feeling like hell, you think that is normal. And so we lost the opportunity to assess whether someone has postpartum depression or not. So really your doctor's office should, if they were following ACOG guidelines, and I'm not trying to throw anybody under the bus because I hate when people do that. It just wouldn't be inappropriate for any of your listeners to request a 2 to 3 week quick tele visit, even, just to get some of those questions answered so that you weren't just sitting out there in the dark,
And this leads me to my next question. Okay, baby blues. Yep. This is very quick after the baby's born. Am I right?
Yeah. Yeah, but first couple weeks. And I always tell people, like, I was telling this one patient, I'm like, let's pretend, because by the way, we are mammals, even though we act like we're superhumans and all this stuff. Let's pretend we're a mama fox, or let's take it down to like a bird, an eagle, a mama eagle. Oh man, I'm pregnant. I'm a mama fox. And I got a couple other babies that are, out fending for themselves, doing their own thing. No worries. And then I decide I'm going to have these babies. So I just lay around the den and I'm just waiting for somebody to bring me a half chewed up, puked up groundhog to lay here and feel good about myself because I'm a mama fox and I'm birthing baby foxes. And then we birth the baby foxes and I birth these baby foxes. What am I going to do? Eat these placentas and maybe lick these babies a little bit and then lay on my side all effing day long. Okay. Doing absolutely nothing else at all except sleeping while these self-sufficient little baby foxes suck on my nipples, and I wait for somebody else to come and barf up some other type of food that they went and collected for me. Thank you, Daddy Fox. Now, that is so not what we get the opportunity to do, right? Specifically, if you had another baby. Yeah, F that. Number one, who in the heck is supposed to go from sleeping, well, you were probably peeing a lot, right, in your 3rd trimester, but going from sleeping to essentially having no sleep for 2 to 3 weeks. But we're supposed to function like that. That, by the way, is some kind of way that we do like torture interrogation to people. We're like, let's just keep them awake for a day and a half. Well, welcome to motherhood. And on top of that, guess how much time somebody got to stay home and help you barf food up for you while you laid and did nothing except nudge your newborn? Nobody. Then thank you, society, for making me feel like a crappy mom for not having every single gizmo and gadget and have all my 1 day, 2 day, 6 day, 12 day blanket that said 1 month, 2 month that I laid my newborn on with this awesome outfit and took pictures of and had the time to put it on Facebook. F that. Who has time for that? Nobody. And then, by the way, the in-laws are everybody who wants to come over and visit me, and I got to get up and act like I don't feel like shit. My pits are stinking. I got stuff leaking out of my nipples, but I have to smile. And by the way, yeah, let's order food for everybody. Last I checked, Mama Fox told everybody to F the F off. That's what she did. So, by the way, depending on your home situation can contribute significantly to how good you feel in the postpartum period. I was so happy with COVID, and I'll say this right now, and I don't even care. There were so many people who were like, Dr. Davis, I hate to say it, but by us having the excuse of COVID, I didn't have to deal with anybody coming to my house to see this baby. They were so happy. Same for the hospital. I didn't have to, 7 hours after a child birthed through my vagina, I'm supposed to sit here looking great with my hair combed while you come up to the hospital. I haven't effing slept, and my vagina just got stitched up, and you want me to sit here and smile because on your time you wanted to bring me flowers and balloons and want me to smile at you when I just feel like hell? How about that? How about give yourself a freaking break? So baby blues to me is normal. It's just feeling freaking like a human mammal who just had a baby who actually is trying to function outside of what mammals are supposed to be doing. Baby blues last for 2 to 3 weeks. What baby blues is I'm just feeling overwhelmed. Oh my God. I'm exhausted. I don't feel like I can get all this done. Shut up, Brian. I'm just saying, you don't understand. That, snapping every once in a while, crying, randomly crying for no reason except that I love this baby so much. I can't even believe I ever loved this baby so much. I'm just randomly going to cry. Commercial comes on, I'm crying. My vagina hurts. I don't know if it'll ever get back to normal. That's baby blues. What baby blues is not is I'm feeding this baby because I have to feed this baby, but I don't feel like feeding this baby. It doesn't bother me if nobody brings that baby to me and everybody's just holding the baby. That's totally fine. Whether the baby's here or not, or somebody takes the baby, I'm not going to get up and shower, and I haven't eaten at all, and I just have no incentive to do so. When the baby's upset, it doesn't upset me. It does upset people with baby blues that I think that the baby loves everybody more than me for a small amount of time. But if you say the baby doesn't care anything about me for weeks, that's not okay. And that is why we in the medical community are supposed to call and make sure a person is feeling not that, and give reassurance for people who are a mama fox whose other set of fox babies is still in there asking for. Do you see Mama Fox taking them kids to school? Them little baby foxes to school? Do you see her doing that? Do you see her out there trying to pack lunches for her other baby foxes that she's got going on, the second set? I don't. Do you see her cleaning up their rooms and sitting at the little baby den doing baby fox homework while she's got another couple on the teat? That's a no. Okay. So that type of overwhelmed, I have too much going on, I don't have time, is so, because you don't have time. How about that? How about we give somebody a minute? Don't get me started. You know what you want to
I think you've gotten started, and I'm just sitting back and let you go, let you do it.
Yeah. Because I've already gone there like multiple times. But the point is, there is normal. I'm overwhelmed because I don't have societal support, or people don't understand boundaries. And excuse me, I am working on my boundaries, and you can just tell people this ain't a good time. Like we would, and can you believe that Leslie and so-and-so said they would not want anybody to see the baby for 3 weeks? Yeah, F off. Because freaking she doesn't want to have to put a bra on and make you a crudité table so that you can come over here eating snacks, feeling good about yourself when she just had something come out of her vagina. So get over yourself. How about that? How about that? Okay, that wasn't nice, but I don't care. And anybody listening, I hope you take it to heart, because I don't care. Because I've had too many people come in exhausted trying to keep up with the pregnancy Joneses or whoever them folk are. It's too much. It's too much. So half people aren't depressed. They just don't have appropriate boundaries, or other people who respect those boundaries, which is a whole separate situation.
Okay. Yeah, there you go. When the baby came out, I was like, why do I still look 4 months pregnant?
Correct. Are we looking for perfection?
What is that about, though? I know. I'm asking you. I'm prompting you. I'm prompting you. No, I'm prompting you to answer the question for all of my super high-level athlete women who are like, you took the ball out from under the sheet, so why isn't the sheet flat?
Are you crazy? Like, think about not flexing your ab muscle or your bicep muscle for essentially 5 months, but then expecting as soon as you go to pick up something it to contract as much as it did 5 months ago. That is hot mess ridiculous. And by the way, nobody gives a who what you look like right after you had a baby. Congratulations, you just had a baby. Let's work on that. All this self-image stuff, everybody, when they are laying flat, they might see a little bump in their belly and they stand up. All that gas, all those bowels that were shoved up, way up high are, thank God, nothing else in the way. I'm going to just expand myself as much as I can. Thank God. It's supposed to be like that. It's gas. It's not fat. It's just gas. Like, that's supposed to be like that. So, yeah, that's just tough cookies. I don't even know what to say about that. That's what everybody looks like. And you're supposed to. I can't stand it when I see people on TV like, oh, she's back to her original weight in 5 seconds. That's not healthy, and she's in a corset or something, or she hurt herself to do that, i.e. pubic bone, i.e. diastasis of your rectus muscle. Can you give yourself a second? What the heck? Yeah, no, you just got to get over that. That is normal, natural physiology. We have to embrace that and love the way our bodies look. We just birthed a child. Congrats on that. Yeah,
I was like, what do I look like?
I'm not here for it. I am not here for it. And that's our fault as society to make the person who literally just had a baby even be thinking about that. That's our fault societally, that a person would even be considering anything except look at my gorgeous body and praise God my baby is healthy. Like, that's the only thing that a person should be thinking about immediately postpartum. But not, why not? Because we do this to people. And that's our fault. We got to do better. We got to do better for our next generation, which is like my goal in life.
I feel like this is going to help some people. I do.
We are not thinking about body image when we just had a baby. And I'll tell you what else. Quit trying to lose weight while you're nursing. What the F? What do you think milk is? It's fat. Your body's trying to use fat. You'll stop making milk if you're trying to like be on an Atkins diet while you're nursing. Stop doing that. And why do you have to be super bone rail thin when you're nursing? If you decide this body image for whatever reason is really important, then just stop nursing and be okay with that. But don't try to and then beat yourself up when your milk doesn't come in. To do both of those, they're mutually exclusive, and they should be. Or you're not giving the right nutrient to your baby. So no, don't do that. But you look like right after, celebrate it. And we need to do more celebration of ourselves. We just had a freaking baby. Celebrate that. And say to yourself in the mirror how amazingly awesome you are that your body did this. You create, and what I always tell my mom is I'm like, let me tell you, you are the best mama this baby has ever had. And you need to say that to yourself, even when we're not winning, right? Because we do something to ourselves that we act like we're supposed to have the same product as as a mama fox, but we're running around trying to make fox lunches and fox homework and fox dad's a a-hole or fox nobody's here to help me or whatever else it is. That's not those. Stop it. Hashtag, and I say hashtag, I do it for Carrie because I don't know how to use electronics. I don't even really know what hashtag means. But hashtag winning, like, for being a mom and for having this baby come out. Like, awesome. You produced a life. Let's just take a minute and suck that in for a second. Let's just take a minute and suck that in and celebrate that and say how awesome we are to ourselves. We have to do it. We have to have better self-talk.
Okay. Thank you for talking because it made me take a second to know where I was going. Okay. So some physical stuff that if you do see it or something, and it is something that the doctor needs to look at. For example, like my friend was like, okay, so I look down and it looks like there's another baby crowning out of the JJ, but I know that I'm not right. Prolapse, right?
It's her bladder. Well, it's not her bladder. It's her anterior. It's the front wall of her vagina, but it's just because it's still floppy. And she has no estrogen if she was nursing. So it's going to take a while for all that to firm back up. And then it will. And then people do Kegels or not, or this or that. And it helps sometimes. Sometimes it doesn't. But that's all that is tissue just going back to normal. That's all.
Okay. Is there anything else that you're like, oh, they need to come in?
You need to come in if you couldn't stand it and he was so cute, I had sex early and blew my stitches out in my bottom. That you need to come in for. The reason I say that, and because there's a ton of people who are too embarrassed to say they had sex before the 6 weeks, whether it was because they really wanted to or their partner, or they don't feel strong enough to say no, whatever it is. But that is such a high risk for an infection. I had to take somebody back to the operating room one time because she had essentially necrotizing tissue in her vagina because she waited 1.5 weeks to have sex and then blew all of her 3rd-degree stitches out and didn't tell anybody. So we had to put her back to sleep and cut out a big V out of her vagina to try to get that back together. You need to come in if you think that something's going on with your stitches. You need to come in if you have a fever or if you have foul discharge coming out of your vagina. I don't mean like old blood smell, like, oh, this is irritating. I mean foul, like creamy colored, pus colored, like, hey, this is white with some blood in it. That should not be happening. You need to come in for that. If you have a temperature greater than 101, you need to call somebody. It may be something else, mastitis, any other thing, but specifically if you have a tender uterus and you have foul stuff coming out of your vagina, you need IV antibiotics. That's endometritis. And depending on the bacteria that is causing your endometritis, you could need to be on, like that could be really bad really quick. So we need to assess that and see if we need to get you some IV antibiotics. If you feel like you're not bonding well with your baby, you feel like something is not right mentally with you, I don't give a who, what it is. You need to come in and talk with somebody. It's hard sometimes because of the way offices run. I don't know how it works there, but we're so thin that a lot of times I'll end up seeing somebody who I've never met before. I don't care who it is. We all have been trained in assessing people for postpartum depression. And it's not okay. And we don't want you to sit there like that and think that it's normal for 6 or 8 weeks. That's not okay. Just to say it out loud, postpartum is a really, really high risk time for physical violence in a relationship and infidelity. If you feel like you are not safe at home, you need to tell somebody about that. And it's really terrible to have to say that, but there's so many people that we don't often ask the question. I ask the question humbly because of some personal stuff I've been through, but we need to say, do you feel safe at home? It's one of the questions. Who's helping you at home? Do you feel safe? And specifically ask about intimate partner violence for people. If you have any food insecurity, again, need to tell somebody about that. What other medical things? If you think that you have, because postpartum period, you can get blood clots. If you feel like, man, my calf is hurting really bad. I have a cord down the back of my calf. This is red and raised. When I go to flex my foot towards me, it hurts really, really, really bad. I can't do a calf stretch on the wall. You need to tell somebody that, because just the hormones in pregnancy in general can cause people to have clots. That's why we tell people you can't start your birth control for at least 6 weeks till that hormone gets out of your system. I want my pills right now. No, diva. We're going to wait 6 weeks on that so that you don't increase your risk for getting a blood clot in your legs. So that would be a reason you would need to come in and be evaluated. Yeah, most hospitals have people who can help with, like, I'm having trouble with the latch for my baby for breastfeeding, or I'm having mastitis problems. That's something you can cover at the hospital. You don't necessarily need to see a doctor for that. But the ones I mentioned before, definitely don't feel, definitely self-advocate. Or if you have a friend who's having any of these symptoms and they're not able to, and one of the key things that makes people not be able to self-advocate is depression. So if you see somebody who's exhibiting any of these symptoms or signs, please help them or offer to help them, because a lot of times they're too exhausted to do it for themselves. Like they truly can't. They truly don't have the ability. And I'm not trying to put that on anybody, but certainly would notify the support person or someone else who would have the opportunity to get a hold of somebody at a doctor's office to assess
Dr.
that.
Janae, is there a percentage of moms that end up having postpartum depression? Is there a statistic on that?
I don't have the exact statistic, but there's people who have increased risk for any social disruption, not good partner support, history of depression, history of postpartum depression, physical violence in their relationship, not having adequate time to be home from work contributes to that, financial stress and strain. A lot of them, like I said, they're not by themselves depression. They're stressors that cause people to become so overwhelmed that they feel depressed. Yeah, but the main thing for people specifically, they're like, I think I'm trying to get pregnant, so I'm going to get off my antidepressants. Nobody said that. Nobody said that. That's old school. Like, we always want a mom to be treated. It's always better to have a medically treated mother be pregnant than a non-treated depressed mother. The types of hormones that go to the baby and the ability for that mom to be able to adequately care for herself during pregnancy is too important. So there are a few drugs that we would prefer. There's a few drugs that we would prefer over others. So if you are thinking about becoming pregnant and you're on antidepressants, then you just want to talk with your physician to say, hey, thinking about getting pregnant, which of these would we like to switch to, or can we get myself out of polypharmacy? So there's a lot of people who take multiple medications, a little bit of this and a little bit of that, a little bit of this. We try to get you on the highest dose, maxed out on one medication instead of having multiple medications. But we are not taking people off their meds at 36 weeks. That is hot mess. That's just a setup for someone just becoming depressed. And like I said, we just want to honor where people are medically. Now, if you've been on my Prozac for 20 years and I just never tried to get off of it, well, we'll talk about weaning it so that you're on the lowest dose that you need. Or do you really even need it anymore? Maybe you started it during a divorce with hot mess Rodney, and now everything's fine, he's gone, and then Tom, Tom, yeah, and then I got back on my meds, but maybe everything's fine because George is amazing, and,
oh my God,
maybe you don't need it at all. So we always have that conversation, like, do we really need this? And if we need it, then we need it. And we don't stigmatize that. We honor that. We want to have a healthy mom. So that's
okay. So now that you've scared all the people who haven't had kids before.
Right, girl.
So do you have any advice for ladies who are pregnant right now or going to be pregnant for the fourth trimester?
You mean like for the fourth trimester?
Yeah.
Set some good boundaries early. Stop trying to keep up with everybody in America who put on Facebook this little picture of their baby next to that calendar blanket. Don't worry about that. And I laugh because somebody, I forget, one of my friends sent it to me, but it was like it was a post of those pictures and then what it looks like in the background of that picture, and it's a shit show. Like, that blanket with that baby on it is the only thing that is normal or typical in that picture. Like, there's 3 other kids that are like tied to a chair. There's a box of Cheerios thrown on the floor, like you're throwing a ball at this toddler to tell him to go get it so you can snap this picture. It's so unrealistic. Nobody's sitting around with nothing going on taking these pictures. This is hot, man. Just stop lying. Stop Stop lying. You know you good and damn well ain't over there with everything ducks in a row, or you're just not a typical person. Like, and where's the badge of honor for saying, I just need a minute? Like, you're allowed. So if you are getting ready to start thinking about being pregnant, or you are in that 4th trimester, set those boundaries now. Hey, everybody, just heard this crazy doc from Ohio. Gonna go ahead and try it. We're gonna see what it's like just inviting you when we're ready. And God loves Zoom and Skype. We're gonna set a Skype time. Like, let's send everybody in the whole family a link for 8 p.m. on week 1, week 2, week 3. Get them all at the same time. Why are you making a crudité table? I'm not scooping out watermelon balls for this shit. Are you crazy? You can look down Zoom, sip and see. I think that's what they call them now. Let's do a little sip and see. Like, you see me sip, everybody grab a beverage, and you're just going to see me with this baby one time. And guess what, everybody else? Honor that. Honor that with other people. Give me a break. Like, everybody needs a minute. And just be able to say that and just set boundaries that honor yourself, and make sure that you request, hey, can I just have a little 2 to 3 week visit? I just wanted to make sure that, I'm a new mom. These are the things that are going on with me, that they're normal. Thanks. They'll be like, oh yeah, we totally already do that. Awesome. Good to know. But yeah, self-advocate early for that. Have one person who you ask, if it's 3 a.m. and I'm about to lose my shit, can I call you? Have that person's number that you said out loud. If it's 3 a.m. and I'm struggling, can I call you? And let them say yes out loud to you, so that you're not struggling at 3 a.m. when you're crying. Because all of us have been there, right? Like, I had postpartum depression, specifically with my second baby. I have anxiety anyway, which I probably told all you guys before, which is probably why I'm so, like, transparent about my struggles. But, like, my anxiety is brought on heavily by sleep deprivation. So when I'm on call for 72 hours in a row or whatever, like, I mean, I can hardly sometimes drive down the road. I think everyone's going to slam into me. Like, my nerves are bad. So whenever I have my babies, like, I literally would see I'd walk to the stairs with my baby and see myself dropping the babies down the stairs. Like, I would see them tumbling out of my arms. Oh my God. I had to sit down on my stairs and on my butt each step, get myself down the stairs. I couldn't even get down the stairs if I had been awake for too long, trying to deal with this breastfeeding or whatever else was happening. And just a hot mess. Then I would see horrible things, like, she'd be crying and crying and crying, and she was only 5 pounds. I gotta feed her. She has to gain weight. What's happening? I wouldn't get sleep. I'd walk in there to go look in her crib, and I'd see myself putting a pillow over her face.
Wow.
I would see it in my mind. I would see myself doing it, but I wasn't doing it. And it scared me so bad. It scared me. I'd have to leave the room. I'd be like, oh my God, because I would never want to do it, but I would see it happening. But that's part of my mental illness. That's part of my anxiety. What happens, I'll see cars run into me, or I see this type of stuff. And so now, my one baby's 18 years old. My other one's 11. I can say that with such compassion when I talk to my moms, and I'm like, listen, you are not a crazy person. Those hormones and that sleep deprivation, aligned with whatever we have going on in our system, in our minds in general, can be so scary. It's okay to say it. And I tell all my patients that, so that they know I'm a safe space. So whenever you're talking to anybody who's going to have a baby, or just having somebody's number, listen, this crazy doc from my house, she said, I just got to listen, Janice, can I get your number real quick? Girl, if it's 3 a.m, I got to call. Kid, is that okay? She just told me to write it down. Just to know that you have a person you can call will take weight off of somebody. If you're listening to this and you know.
Oh my God, Dr. Janae, I had postpartum anxiety as well. Not in the same form. Like, I didn't have those thoughts, but it was the hardest 3 months of my entire life. Her first 3 months of life. And I wanted a baby. I wanted a baby so bad. And I love her so much. But it was really hard. It was really terrible. And I for me, it's very interesting that you talked about, like, the whole antidepressants, old school, new school, because I went the old school and I had a little bit, I had that pregnancy hormone. So I weaned myself off Zoloft because I always, like, I thought I didn't need it anymore, because I was one of those people who was like, I've been on it for a couple years. Right. I was on 100 milligrams a day. I was like, you know what? I don't think I need to be on this anymore. And then the baby was born. All of my levels completely dropped to the ground.
Yep.
And now
And by the way, Zoloft is one of the most common that we start people on because it was studied the most with breastfeeding.
Okay, right. And so I went to see my primary in tears. This was like, I was already struggling and then got put back on it. And now I realize, because I think back to me as a teenager, a kid, a 20-year-old, I couldn't stop crying. Ever.
Correct.
I was crying all the time. I was emotional all the time. And I'm a pretty strong person, but I would just respond to things with tears. So I know now that until my chemistry changes a lot, if that happens, I'm on it. Because it makes me a normal person.
It makes you you. I don't want to say normal or abnormal. I would say it makes you feel like the best version of yourself.
Yeah.
And that's what's okay. Like I tell girls all the time when they come in, like, when I'm on my period, I'm crying sometimes. I'm like, is it impacting anybody else? Are you getting ready to get fired? Like, if your friends just need to leave you be a little bit, that's not impactful to their life. Like, you don't have to apologize for having a small hormone fluctuation. If, however, I'm crying all the time, Dr. Janae, there's nothing, I can't bond with people. I can't even focus. Then that's when it needs treated, when it's bothering you, not when it's bothering necessarily somebody else.
Yeah. It makes me feel like I can function and I'm not, I can have rational, like it makes me like not as irrational. When you're crying all the time, you're making decisions in an emotional state. Yeah, so I'm just really grateful that I figured that out, although it took me longer than I look back, I wish I had figured it out earlier, but it's okay. I'm still young, But I think this is going to be really important for my audience out there, because Dr. Janae, I think I can say in concert with all of my ladies that we all wish you were our doctor, because like I don't get anything. And I know that you're on a podcast and you don't have an hour with everybody, but you know what I'm saying? Like, there's so many women out there who don't, number one, get the information. Number two, feel like they're in a safe space. Number three, feel like they can go to somebody over and over and be, like a trusted person. So I really feel like, if you can be that for them, just like a voice. And then if they really need to go and see their doctor because you have brought something up that they've never heard about, but they're like, oh, I have that. That sounds like me. Yeah. Then they can go get themselves taken care of,
One thing that I will say, which I don't know, like nationally, we're moving more towards, because the long and short of it is we're running out of doctors, particularly in obstetrics. Like, people are just like over it because it's so stressful. So there's a lot of health systems that are going to a centering program system. I don't know if you've heard of that or not, but it's basically like group prenatal care. So every week you come at the same time, or once a month, and then twice a week, or once every 2 weeks, and then once a week for your pregnancy. But you're in a group with people that are due like the same month as you, for example. And you all are going to come to these visits, and maybe they're all at 6 p.m. on Wednesdays or whatever it is. Those group visits are so helpful for first-time moms. And I know people are like, I want to just talk to my own doctor. It's so wonderful to sit for the first week and hear about anesthesia options. And an anesthesiologist comes in there and talks for 20 minutes. And then a whole group of 20 of you get to ask whatever questions you want. Now, during the visit, during that hour or 2 hours, I, as the physician, will say, Janice, come here. I whisper, Janice comes in. I do my belly check with Janice. We spend maybe 10 minutes. She goes back to the group. Holly, you're next. Come in, do my little visit. So you only miss like 10 minutes of the talk. But there's a talk on breastfeeding. There's a talk on bottle feeding. There's a talk on labor positions. There's a talk on postpartum depression. There's a talk on substance abuse. There's a talk on intimate partner violence that happens during and after pregnancy. There's a tour of the hospital. There's a whole bunch of different things that happen once a week. So I so highly encourage, they're like, this is some midwifery something. I don't need that. Yes, you do. And the biggest thing about it that I hear women say is, oh my gosh, they ask the same question. There's such a camaraderie that is built between these women who don't know, but somebody else asked the question. It's all safe space. Everybody can stay there as long as they need to. Somebody else is asking the question sometime that you want to know the answer to, but you got it. And you get a snack. Why not? You get a little snack. So I would really encourage anybody, if you can find a centering program, that is kind of for low risk people, what we're trying to push people more towards so that this doesn't happen, so that you can have a 20-minute conversation about your C-section if that's the route you're going to have, and talk about your anesthesia options, and hey, here's what to expect postpartum. And so we can do that with people, because those patients, by the way, in centering get, say you came for 13 visits, 13 hours.
Yeah. So you actually prefer this new structure.
I do for low risk people. For high risk people, you need to see a physician. We're talking about your sugars, your preeclamptic, your all this other shenanigans. That's a different scenario because you're in a different situation. But for low risk people, I 100% suggest a centering program if you could possibly.
Okay, so the centering program, basically, there's a physician like you who's doing all the checks, and then there's one person giving like a lecture, basically.
Yeah, and sometimes it's run by midwives. It just depends on the model.
Okay.
But as soon as somebody turns high risk, like they come out of centering to a doc, like it's not that you have to stay there. It's just really more for information.
Oh my God. I did not know any of this.
Bam! Hashtag
I can't believe you are in my hometown too. Like I cannot.
Yeah, dude, I'm right there.
That's so crazy to me.
Yeah.
And you know what's really sad? I'm coming there for all of 2 seconds because Kelly and I have an event, but I can't afford to stay any longer than 1 day because of my own schedule.
I'll be here. Don't even worry about it. I ain't going
No,
nowhere.
I know, but I want to meet you in person.
Wait, we're gonna meet.
Yeah.
Don't worry about it.
All right, Bean.
There's only so many hours in a day, girl. We don't apologize. We just say, catch you on the flip. That's it.
You want to say hi, Dr. Janae? Oh my goodness. She's so tired. She's been sitting. Have you heard a peep out of her? She's been sitting on my lap the whole time. No peeps.
No peeps.
Are you hungry, Bean? Oh, she just yawned again. Okay. So, Dr. Janae, we pulled it off. Also, we want to do this with Kelly at some point, but we're just gonna annoy you. And then you can just tell us when you're available.
I love this. This is super fun. I love being able to talk. I want to answer questions. And by the way, if there's like a serious question that comes up that somebody doesn't feel comfortable talk to their doctor about, I'm happy to answer that. Like these are important topics specifically around mental health stuff. So please feel free to reach out if somebody needs me.
All right. Oh my goodness. Thank you so much, Dr. Janae, for being with us and carving out the time. And listeners, thanks for being here. I really appreciate you. Go check the show notes for that link to sign up for the 3-part series, Aerial Rehab. And if you would honor me with a 5-star rating and a review anywhere you get your podcasts, it really helps out so much. All right, guys, have an amazing week. That's it for us today. Bean, you want to say bye? Bye. All right, guys. This is Expecting Aerialist Podcast.